So patients will often ask you how many mils they can add in one session. It's worth thinking about what you're actually doing in terms of lip augmentation. You're inflating something which does have a fixed amount of space. Now, if a patient's lips are very small, paradoxically, you may have a lower limit in terms of what you can put into their lips without starting to lose the shape. So I think about lips a little bit like you might think about, those animal balloons that have a specific shape. You inflate them and it looks like a giraffe or it looks like a, whatever. Now, lips are a bit like that as well, except they're not animals. But if you inflate them, basically what will happen is eventually you will lose the shape. So they get rounder and rounder and rounder because as you add pressure into something with an enclosed shape, it will get rounder. And so you will obliterate all the details that actually make lips beautiful. So lower lip angle, tubercles, definition, all of that turns into just a round, inflated, shapeless structure. And the more you put it in one session, the more likely that will happen because filler, unfortunately, isn't entirely static. If it was as easy as whatever you inject is what you see and it stays that way, then that would be easy for us. We could just put in exactly how we want it to look and make a decision on each injection. But most filler will actually attract a bit of moisture. So mostly you get a little bit of extra volume with time as it goes on. And secondly, you get inflammation at the time of injecting. So that also hides some of what you're actually able to see and assess. And for that reason, I like to put a limit of around about 1 mil for most people. Now, I never say never for any particular rule of thumb. There's always an exception, and you might meet a patient who's had 2 mils in previous treatments, maybe you haven't seen them for 3 years, most of the filler's gone. You can tell by the pictures that they can take that kind of volume, and you may make the decision to do more than 1 mil in one session. That's entirely up to you, and you can make the judgment to do more or less depending on the patient and their appetite for risk and the way that you understand their lips. I'd say 80% of people it's 1 mil, with an occasional 20% of people who might take 2 mils. And of course, it also depends on your product. So it depends how volumizing your product is. If you're using a product that's less good at volume and better at definition, which is often the tension, you may want to use slightly more to get the same amount of volume. But rule of thumb is 1 mil. Possibly 2 mils in 20% of people. Hope that helps.